What is foam sclerotherapy and exactly how does it work?
Sclerotherapy is the injection of a substance into a vein to kill it. The foam sclerotherapy is an improvement that actually was invented first of all in 1935, but has only recently become more popular again. Sclerotherapy works very, very well for small veins like thread veins, because when you inject, the blood gets pushed out and so the sclerosant, the liquid, just kills the vein, and it works very well. In bigger veins, the sclerosant can mix with the blood and therefore it doesn't kill the vein wall, and so we really want to get the blood out of the way. By making the sclerosant, the liquid, into a foam, by mixing it with gas, initially air was used, but that can be dangerous, so now we use carbon dioxide and oxygen. By mixing them together you get a foam like shaving foam. The injection of the foam pushes the blood out of the way, leaving the sclerosant to affect the vein wall itself and to kill it. So therefore we can now treat far bigger veins, up to about 4 to 5 millimeters successfully, using foam sclerotherapy.
I've heard that sometimes you can be left with brown spots after this treatment.
Yeah, it's very important because the foam only lasts for about 4 minutes, and of course it takes 14 days for the vein to be completely fibrosed and shut away. So in the meantime you mustn't let blood come back in. If blood comes back into a dead vein it will die, that means get a clot, and clotted blood will cause brown stains, a process called hemosiderin. So what we have to do is, as soon as the foam is in, we need to put a compression on to make sure that no blood can get back in, and in most people that's very effective. We also give drugs to stop the inflammation. Now in some people you can still get some blood coming back in because it's not, maybe the compression isn't quite right, or maybe they've taken it off. In that case we get people back at 4 weeks after the procedure, and if they've got any blood in the veins at all, we just do a little pinprick to remove that clotted blood to reduce the brown staining.
Does it hurt?
The process itself is actually quite painless, or you can feel a little injection when it's done, and so it's really not too bad. I think the worst bit about it, and what most people say is the worst bit about it, is firstly having to wear compression for 14 days and nights, but it is essential you do. And the second thing is the blood release, because you do have pinpricks to get the blood out. Now it is, if you can wear the compression properly, then of course you've got much less chance of the pinpricks getting the blood out. So it's still a very good technique, but it really does need the patient to wear that compression for 14 days and nights to get the best results.
Is it suitable for everyone?
No. Foam sclerotherapy, there's some people who are trying to make it suitable for everybody because they want to replace surgery with it, but the figures are very, very clear. If you have a small vein, so anything up to about 3 millimeters, foam sclerotherapy or sclerotherapy used in the right combination are very, very effective. Between 4 and 5 millimeters it starts dropping off, and in bigger veins it just doesn't work very well at all, and you have to go to the heating catheter-based techniques if you want good results.